Assalamu alaikum أعزائي الطلبة. Today we will discuss the rest of cardiovascular system symptoms or symptoms of cardiovascular diseases. After we finish the chest pain and the shortness of breath as an important symptoms and common symptoms that presented due to cardiovascular disease, now we will discuss the palpitation. Palpitation, in its definition, is an unexpected awareness of the heart beating in the chest. So once a patient being aware of his own heart beats, it's called as palpitation. So palpitation is not necessary to be just due to tachycardia. There is a difference. Sometimes the patient might have normal heart rate, or even sometimes when a patient have a heart rate of low heart rate or slow heart rate, we will have the sensation of palpation. Patients experience as a rapid, forceful, or irregular cardiac impulse and describe this as thumping, pounding, fluttering, jumping, racing, or skipping. It's usually due to tachycardia, rapid heart rate, but sometimes it is not related to tachycardia with this feeling. You should ask the patient to tap out the pattern with their fingers to clarify its rate and rhythm. And this is particularly important when the palpitation is paroxysmal, meaning comes in attack. And when you do the medical interview and the examination, you will find the heart rate is normal and the patient have no palpitation. So this rememorization by tapping the fingers is very important thing to distinguish between the regular and the regular irregularities and the irregular irregularities that might present in cases of ectopics or atrial fibrillation, respectively. Palpitations may occur in sinus rhythm when the rhythm is normal, with anxiety, and with intermittent irregularities of the heartbeat, like in cases of extrasystoles or ectopic beats, or with an abnormal rhythm in cases of arrhythmia. Most patients do not have a sustained arrhythmia, and not all patients with arrhythmia experience palpitation. For example, atrial fibrillation commonly causes an irregular heartbeat in the elderly, but rarely causes palpitation. So, as we mentioned before, that many of the patients, the palpitation come in paroxysm or in attacks, and not every patient have the feeling of palpitation, even with severe arrhythmia and harmful arrhythmia like the atrial fibrillation. The history helps to distinguish different types of palpitation. We should ask about onset and termination. Is it abrupt or gradual? And the termination is sudden, and how the pulse rate had been returned back to normal. Precipitating factors like exercise, alcohol, caffeine, recreational or other drugs. Frequency and duration of episodes is very important, and the corrector of the rhythm ask the patient to tap it out. Descriptions of arrhythmia is very important. For ventricular or atrial extrasystoles, heart misses a beat or heart jumps or flutters is one kind of description. In cases of atrial fibrillation, heart jumping about or racing. Associated breathlessness might be unnoticed. Supraventricular tachycardia, like in cases, it will cause heart racing or fluttering and might be associated with polyuria. Ventricular tachycardia, the heart racing or fluttering associated with breathlessness because of its effect on the cardiac function, and patient may present as syncope rather than palpitation. Syncope, this term, syncope, refers to sudden and transient loss of consciousness due to reduced cerebral perfusion. So, it is sudden and transient, not permanent loss of consciousness. Presyncope refers to lightheadedness where the individual thinks he or she may black out. There are several mechanisms that underlie recurrent presyncope or syncope. First one, cardiac syncope due to mechanical cardiac dysfunction or arrhythmia. For example, syncope, exertional syncope due to aortic stenosis or hypertrophic cardiac myopathy, cardiomyopathy. In these conditions, because there is mechanical obstruction or of the aortic valve, there would be reduced cerebral perfusion on exertion. Arrhythmia is the same thing. For example, atrial fibrillation might cause syncope, or ventricular fibrillation also might cause syncope because of the ineffective cardiac contractility and inability of the heart to pump enough blood to maintain enough cerebral perfusion. In neurocardiogenic syncope, in which there is an abnormal autonomic reflex causes bradycardia and or hypotension, is another group of disorders that might cause syncope. And the best example for it is the vasovagal syncope and the carotid sinus hypersensitivity. Blackouts can also be caused by non-cardiac pathology, by non-cardiac pathology such as epilepsy, cerebral ischemia, or hypoglycemia. Cardiovascular disorders produce dizziness and syncope by transient hypotension, resulting in abrupt cerebral hypoperfusion. Recovery is usually rapid, unlike with other common causes of syncope, like stroke, epilepsy, and drug overdoses. In this situation, it is very important in cases of syncope to distinguish between two main types: the cardiogenic type, the cardiogenic syncope, and the neurogenic syncope. The neurogenic syncope, like in stroke and epilepsy or fit, in this situation, we will have late recovery. The patient spent more time and loss of consciousness in comparison to cardiogenic syncope. Another important thing is that there is residual weakness, for example, in cases of grand mal epilepsy, there is some muscle weakness and malaise after the finishing or after recovery from the syncope, neurogenic syncope. While the patient with cardiac syncope, just on lying flat, everything can be corrected because of the increment in the venous return and the maintenance of the cardiac output by this. Postural hypotension, it is caused by many causes like hypovolemia, bleeding, diarrhea, autonomic neuropathy. There is some differences in the blood pressure between standing and sitting or supine position. Syncope on standing upright reflects inadequate baroreceptor mediated vasoconstriction. It is commonly in the elderly. Abrupt reduction in blood pressure and cerebral perfusion cause the patient to fall to the ground, whereupon the condition corrects itself. Vasovagal syncope is caused by autonomic overactivity, usually provoked by emotional or painful stimuli, less commonly by coughing or micturition. Only rarely are syncopal attacks so frequent as to be significantly disabling. Malignant vasovagal syndrome, vasodilatation, and inappropriate slowing of the pulse combine to reduce blood pressure and cerebral perfusion. Recovery is rapid if the patient lies down. For cases of carotid sinus syncope, exaggerated vagal discharge happened following external stimulation of the carotid sinus, like from shaving or a tight shirt collar, causes reflex vasodilatation and slowing of the pulse. These may combine to reduce blood pressure and cerebral perfusion in some elderly patients, causing loss of consciousness. Valvular obstruction is another cause for syncope and the cardiac syncope. Fixed valvular obstruction and aortic stenosis may present may prevent, a normal rise in cardiac output during exertion, such that the physiological vasodilatation that occurs in exercising muscle produces an abrupt reduction in blood pressure and cerebral perfusion, resulting in syncope. Stock Adams attacks, these are caused by self-limiting episodes of asystole or rapid tachyarrhythmia, including ventricular fibrillation. The loss of cardiac output causes syncope and striking pallor. Following restoration of normal rhythm, recovery is rapid and associated with the flushing of the skin as a flow through the dilated cutaneous bed is re-established. Fatigue is a common cardiac symptoms, and sometimes even it is not cardiac. Uh, Fatigue or tired all the time or easy fatigability might be caused by heart failure, for example, but it can be caused also by hypothyroidism, anemia, and other endocrine problems and even psychological abnormalities like in depression. It is due to, it can be due to poor sleep, direct side effect of medication, particularly beta blockers, electrolyte imbalance due to diuretic therapy like hyper or hypokalemia or hypo or hypernatremia, as a systemic manifestation of infections such as endocarditis, in addition to, as I mentioned to you, the hypothyroidism and the anemia and many other endocrine problems. I think this is all for the symptoms of the heart disease. Next lecture, the next week, will be about the respiratory symptoms. Thanks a lot for your kind listening.